Good morning, everyone. Welcome to Fayette County Schools and welcome to this discussion of our employee benefits. We call our employee benefits program here Total Rewards because we want people to think of their total compensation as being made up of both direct pay, your paycheck, and also what we would call indirect pay, which is the value of your benefit plans that are funded for you here at Fayette County Schools. We call this presentation Smart, Confident Decisions because that's our goal. We basically are going to review all the benefits for you this morning. We're going to give you highlights on most of the programs. We're going to get into some depth on the medical plans because they're the most complicated and certainly the most important to you. And then we've got that overall goal of making sure that when you make a decision that you can make it with confidence and that you're sure you pick the right option for yourself and your family, or at least as sure as you can be about a subject like that. On the left-hand side of this slide, you'll see the things that the board pays all or part of. Take special note of what we call state health. I'll share why we call it that in just a second. And then on the right-hand side of the slide here, you'll see the things that you either contribute to or decide to participate in or not. So with a list like that, you can see you've got quite a few decisions to make. And I always like to remind people just how much the board does spend to fund health insurance. We talk about total rewards and you think of your paycheck. Consider also that the board pays to state health, and we participate in the state health benefit plan, which is why the nickname for that plan has become state health. The board's requirement is $945 a month for every employee covered under the plan. So that's over $11,000 a year that the board spends on health insurance before you pay anything. And that's one of the reasons we call this program Total Rewards, because that contribution makes it a lot less expensive for you to participate. That's why we think it's so important to make a good decision here. I think it's helpful as you try to make your decision as to which plan is best to kind of see where is everyone else participating here in Fayette County Schools. And we put this little pie chart together for you to look at. As you can see here, the most popular plan among your colleagues here would be the Blue Cross Blue Shield HMO. Blue Cross Blue Shield is also known as Anthem now, so you see Anthem on the slide here. Same company, different name. Easily the most popular of all the options, followed by the bronze, the silver, and then the gold. And Kaiser HMO, also a popular choice with 6% of folks participating there. We're going to talk about each of these plans in a little bit more detail so we can make the choice a little clearer for you. So we have 7 different plan choices to choose from, and that's a dizzying number for most people. Explaining one plan thoroughly so someone understands it is challenge enough, but 7 is a big task. So what I'm going to try to do here is narrow down the options a little bit to make it a little bit more manageable. I've got the 7 choices arrayed across the screen here. Lots of acronyms. Don't worry too much about that. It's insurance, so it's pretty much unavoidable. Just think of it as names of the plans and don't worry so much about what things stand for. I have the plans arrayed on the slide here from lowest to highest in terms of the cost to join. What's my payroll deduction to be in these plans? And the United Healthcare High Deductible Health Plan is the lowest cost plan option. The United Healthcare HMO, the highest plan option over on the right-hand side of the slide. How do I get this narrowed down a little bit? Well, in my judgment, I think we can take the United Healthcare High Deductible Plan out of consideration. It is the lowest cost by a couple of dollars beneath the bronze HRA plan. But when you look at what you have to spend out of your pocket when you use the plan, the high deductible that's in that plan, I think that clearly the bronze HRA for a couple dollars more is a better value for everyone. So we've eliminated that high deductible option from consideration. We have 10% of folks here participating in the gold HRA plan, but when you look at the cost of that plan and you compare it to, say, the Kaiser HMO or the Anthem HMO, you find that you pay a lot more for it, and yet the benefits are not really any better. We've done a lot of little whiteboard models to test that out, and the HMOs turn out to be a better option pretty much all the time in terms of what you get. So in our opinion, the gold is not a great value. The United Healthcare HMO is exactly the same benefits as the Anthem HMO there in the middle of the slide, and yet it costs a lot more to be in it. Why? Since the benefits are the same, I really couldn't tell you why that particular option is in there and so much more costly. You might pick it if there were a provider in the HMO network for United that was not in Anthem and that you were you really were anxious to have that provider. But I don't think we have that situation that I'm aware of in Fayette County. So to me, the United Healthcare option, not really any reason to choose that. So that kind of leaves us with Bronze, Silver, the Anthem HMO, and the Kaiser HMO, and those are pretty much the popular plans from the pie chart, if you remember that. So in general, how do I pick between those four? In a very general sense, if I'm somebody that needs very little care, so maybe I go to the doctor once or twice a year, I have a prescription or two, that would be what I would call a little care. And to me, that's a pretty easy decision. If that describes me, then I probably want to pay the much lower cost to join of the Bronze plan and avoid the high cost of the richer plan. If I'm looking at maybe having a surgery next year, or I'm looking at having a baby, that means I'm going to have some pretty significant out-of-pocket cost. If I'm at the doctor's office a lot, taking a lot of different medications, that would be somebody that needs a lot of care. But my opinion is that you're going to get a lot more benefits for that outlay than you would in the other plans. And so the richer plan makes more sense for folks that are going to need a lot of care. And if you take a look at the cost, I mean, I've got the three most popular plans here that we just got done talking about, down to these three on lines 2, 3, and 4. So you see the Silver, the Bronze, Blue Cross Blue Shield HMO. HMO being the most expensive, as you can see, but it does the most for you when you need it. You can see that there's a big difference from the lowest cost plan to the highest cost plan. So it really makes sense to think this through before you make a final decision. And of course, you can cover yourself. You can cover yourself and just a spouse, yourself and just your kids, or the entire family. So that's another decision that you'll make as you pick a plan. What does your spouse's plan do if you have two plans available with your spouse working somewhere else? So let's take a look at how the plans work for a while here. First of all, you'll notice that all the plans cover preventive care at 100%. There's a theme throughout the state health plans to encourage you to take good care of yourself, meaning doing preventive maintenance for yourself every year. And every time you do things that are in your best interest from a wellness standpoint, you tend to get rewarded by all the plans. And I'll develop that as we go through our discussion here today. So preventive care covered at 100% in all the plans, which means you have no out-of-pocket costs. So that means you can do things like annual physicals, get immunizations for kids, do your well woman visits, for example. All those things can be done and without any cost to you. They're preventive in nature, and the plan covers all of that. The one thing you want to be careful when you go in for a preventive visit, particularly if it's something like just a physical or something like that, is that if you've been to that doctor before, then make sure you let them know that you want to keep your free physical free. If they code the visit like it's a return visit from that knee problem that you had or that stomach problem you had a few months back, then it won't be coded as a preventive experience, and that is going to cost you money out of pocket that you don't want. So just be careful to remind the doctor that it's a preventive visit. And then we look at prescriptions. I start off there because the way prescriptions are handled in all the plans is basically the same. Mechanically, it's a little different between the HMO option and the two HRA plans, but basically in terms of out-of-pocket to you, it's the same. So in every plan, you'll pay a piece of the cost, and then the plan will pay the rest. How much you pay depends on what tier that medication is, tier 1, tier 2, tier 3. So get familiar with those, with that terminology. Tier 1 is going to be basically generic drugs. They're going to be the lowest cost to you. So you always, if you could solve the problem with a generic drug, you always want to do that. If the generic won't work for you, then you'll be into brand name drugs, and then you'll be thinking about, is it a brand name drug that's on the preferred list or not on the preferred list? It's kind of like a network doctor, not a network doctor. So we're looking for, if we have to be in a brand name drug, we're looking for one that's on the preferred list. And that list is available to you on our website, so it's easy enough for you to find out what they are. So you always want to go to tier 1, avoid tier 3, and tier 2 would be your fallback position, brand name drugs that are on the preferred list. If you can, you want to do mail order. A lot of medications you can get a 90-day supply, and those are eligible for mail order. Why do it that way? Because you pay 2.5 copays instead of 3, so it saves you a little bit that way, I should say. Delivered to your house, you can renew them online, pay for them online. It's just a simpler way to manage your meds and a little less expensive for you too, and a little more convenient. So let's talk about how each of the plans work here for a second. So I'm focusing in again on these three popular plans, and let's start off with the HRA Silver plan. That's the middle one of the popular three plans. So what I've got here is a box of kind of how your expenses will flow during the year when you need health care. So first of all, remember the cost to join. All right, it costs me $110 a month to be in the Silver plan, $1,300 a year, coming out of my check before taxes, so it's not going to feel like this much in take-home pay. But I've got a fair amount to pay each month to be a member of the plan. And then what does it do for me when I actually need it? Well, remember we said that preventive stuff is covered at 100%. So I've got it here in this on this slide represented with this blue bar. When you see blue on the slide, it means that the plan is basically paying that cost for you. And when you see red, it means that it's an out-of-pocket cost to you, or at least a potential out-of-pocket cost to you. Preventive stuff, as we said, is covered at 100%, all blue on the slide. If I need a prescription, what do we say? We pay a piece of the cost. That's the little red sliver here on the slide. That's your portion to pay. It could be tier 1, tier 2, tier 3. If it's tier 1, the red's going to be the smallest. Remember, that's your out-of-pocket cost. So that's your goal. Every prescription that you get, you pay a piece of the cost, and then the plan pays the rest. So it'll look like this during the year as you get prescription drugs. And pretty much everything else in the Silver plan is covered after deductible. And the deductible is a pretty big number in the plan. So you got this big red box, which nobody likes to see. In the Silver plan, it's a $2,000 deductible. What's the deductible mean? It means that before you get any other care paid for, you're going to pay $2,000 for that care. Obviously, as you incur the expenses and the cost, you'll pay until it gets to $2,000. Once it gets to that $2,000 mark, this plan gets pretty good. 80% of your bill is paid, so there you see the blue. 20% is paid by you. And the greatest thing about this plan and all the plans is that they have these so-called out-of-pocket limits. And what that means is if when the red on the slide, so whether it's the copays for those medications, whether it's the deductible, whether it's at 20% that you're paying after the deductible's met, when all that red gets to a point where you spent $5,000 out of your pocket, the plan's going to pay 100% of your bills after that. So you see above that green line on the slide, all blue, which means the plan pays all of it for you. The last thing I want to mention on the Silver HRA is this little blue box at the bottom of the screen. It's called HRA account. In fact, the whole plan is named after this little blue box. Why is that so important? Well, the HRA account is an amount of money that you get when you just for joining the plan. So you don't deposit it, you don't contribute it. When you join this plan, it's there for you in the plan to use. What does it do? It helps you meet any out-of-pocket expenses that you have in the plan, like the deductible. And in this example, you see $200 going toward that $2,000 deductible, leaving me with just $1,800. Because you guys are joining kind of in the middle of the year, you're going to get a prorated amount in this HRA account to get you to the end of the year. So it won't be a whole $200, but you'll have some money in that account. You'll pay expenses out of that account until it's gone, and then you'll start to meet your deductible. Okay. So the blue box is important to you, and then when you join for the new year in 2021, that box will be replenished, and every year that this plan's been in effect, that blue box on January 1 has been $200, again, getting added to your account. If you don't spend any money, those dollars just stay there and accumulate into the next year. Now let's take a look at the family version of the Silver plan. Looks like the slide's exactly the same, and it really is, just the numbers are a little bit different. So let me just point out a couple of different things about the Silver family plan. First of all, obviously, it costs a lot more to be in it because in this plan, you're covering 3 or more people. So you've got a much higher cost to join, again, coming out of your check before taxes. The deductible for a single person in the family is exactly the same way it is under the single coverage. It's just a $2,000 deductible before you start to get your 80%. But for the entire family, you have a limit of $4,000 total that the family can spend in deductibles before everybody in the family starts to get 80% of their bill paid. So a great advantage in the family plan to have that limit on what the family can pay out of pocket. Now, what you'll usually see is only one person will be that ill in a family typically in a year. And so what'll happen is, let's say just dad gets sick He'll have a $2,000 individual deductible. Remember, we talked about in the single plan. And then he'll have this family HRA account. And he'll probably use all of that money up in meeting his deductible before he pays the remainder of his $2,000 and starts to get 80%. So just a little bit different way of the plan working, but it protects the family from just everybody having to meet the individual deductible. And as a family, I've got a $10,000 out-of-pocket limit for the entire family. The individual out-of-pocket limit that we talked about in the single version still applies, but the whole family can't spend more than $10,000 out of pocket. So what you have here is tremendous financial protection in this plan. The trick is the big red box, and how do we make that as small an impact on our wallet as we possibly can? And I'm going to talk about that as we go through our discussion here. So now let's take a look at how the HMO works. Remember, this is one of the 3 popular plans as well. And you can see it, the graphic is quite a bit different. Preventive visits covered the same way, prescriptions covered the same way as we talked about. But what's really different about this plan is that your doctor visits are covered after a copay as well. So in other words, you're not paying off that big red box. You're not meeting that deductible or worried about how much money you've got in your HRA account, the blue box. In this case, you're paying a copay to go see the doctor, and then the rest of the cost is covered, not unlike your prescription. So if I go to a primary care doctor, my copay is $35. If I go to a specialist, my copay is $45, and then the plan pays the rest of that doctor bill no matter what it is. Okay, so a lot of people like that because it's very predictable. They go to the doctor, they just pay that single flat amount, and then they're basically done for everything that the doctor can do in his office. Okay, after the doctor visits, everything else is covered under this plan after a $1,300 deductible. Remember, in the silver plan, my deductible is $2,000, offset by that money going into my HRA account, but still quite a bit higher than what we have here in the HMO. So lower deductible before I start to get 80% of my bill paid. And I've got a little smaller out-of-pocket limit in this plan as well, $4,000 instead of $5,000. So again, a little less out-of-pocket in this plan. And look at what I contribute to be in it. Just a little bit more than I would have been in the silver, would have contributed in the silver plan. Remember, it was $110 a month, and here we are at $135 on this plan. If I look at the family version of this, again, the graphic looks almost exactly the same. I would make the same points that I made for you on the silver family, which is that it costs a lot more to be in it because I'm covering a whole family. I have a family deductible of $2,600. That doesn't change the fact that the individual deductible is $1,300. So an individual is not penalized for being part of the family. Once the family has spent a total of $2,600, then everybody in the family is getting 80-20, 80% of their bill paid, and you paying 20%. And then you've got that family out-of-pocket limit, which again is a little bit lower than it is in the silver plan. A little bit stronger plan. And remember, when we talked about these plans on the earlier slide, we said that the HMO might be the best for a person who needs a lot of care. Well, here's the 3 popular plans side by side. So there's the silver in the center of the slide that we talked about. There's the HMO that we just finished talking about on the right. And there's the bronze over there on the left, which remember is the most popular plan in the system here. And you can see probably why. It costs a whole lot less to be in it. I've got the annual cost for these plans across the top, bronze, silver, HMO, and you can see that the HMO is almost double what the bronze plan is. Okay, so why do you decide to pay extra money to be in that plan? Well, if you just take a look at all 3 of the graphics, you'll see that there's a lot more blue on that HMO slide and a lot more red on that bronze slide. Remember, red is out of pocket. So I pay a lot less to be in the plan, but then when I use it, I have the potential to pay quite a bit more out of my pocket. Now, if I'm a healthy person and I hardly ever go to the doctor, and I look over there at the bronze plan, I say, gosh, it's got a very big deductible that I have to pay before I get anything for my doctor visits on the plan. But if I'm really healthy, I don't really plan to go to the doctor. I don't expect to have to or to really meet that deductible, so it doesn't worry me. And that might be the best place for me. On the other hand, if I expect I'm going to have a hospital stay, maybe for a surgery, maybe because I think I'm going to have a baby, then paying a little bit more to be in the HMO might make sense. For example, if I'm going to have a baby, I'm certainly going to spend a day in the hospital. That means that in either of these plans, I'm gonna meet the deductible. Well, I'm gonna have to meet a much higher deductible in the bronze plan than I do in the HMO. So that's a big reason to be in the HMO instead of being in the bronze plan. I make up the whole cost difference, more than the whole cost difference, just because of that one day that I spend in the hospital. The other great thing about being in the HMO is that all your prenatal visits are covered. Remember, the doctor's covered after just a copay. So I have just a single copay to pay before the doctor visit gets covered at 100%. For prenatal visits, only one copay applies for all your visits. So you pay one copay at the beginning of your care, and that's the last copay you pay to the doctor. So it's another big savings for being in the HMO. And the beauty of these plans is, remember that you're not picking a plan here for life. You're picking a plan for the coming period. So I might be somebody that is young and healthy, and I'm a perfect candidate for that bronze plan. But as the years go by, I get married. Now I'm ready to have a baby. I might think about switching from the bronze to the HMO to have the baby because it's going to cost me so much less out of pocket total. Yes, more to join it, but I'm going to pay so much less when I actually get my care that I'd like to be in that plan for the year I have the baby. And then if everybody's healthy, I might want to switch back to the bronze plan in the very next year because it's so much less expensive. Everybody's healthy. We're not expecting to have to spend a lot of out of pocket. And so the HMO may be the best choice. So now let's talk about wellness. Remember I said early on that state health is really encouraging us to take good care of ourselves. That's why they're paying for the preventive stuff at 100%. And that's why they have this so-called wellness program built into all the plans that we're talking about here. And everybody can be in the wellness program. Everybody should be in the wellness program. But typically, if I ask the question among a bunch of employees, how many are in the wellness program? About 25% of folks will raise their hand. And it's disappointing to me that's all we get because this is really helpful for everyone and saves you a lot of money. The way the wellness program works is you'll have a number of things that you need to do. They'll give you a window of time to do them. This last year, it's been 1st of January till the end of November. Activities that you do that earn you wellness credits. And they keep changing this program up on us and changing some of the terminology. But basically, for 2020, you're earning wellness points. Those points can be redeemed for credits. We're talking points and credits. But look, they're dollars that come to you for doing smart things about taking better care of yourself. One of the things they offer is that you can convert these points into a Visa gift card if you want to. I have it on the slide here, but I think it's a crazy idea. I mean, you can earn up to 480 points. They're worth $1 a piece when you get right down to it. Why would you trade those $3 for one basically to get a Visa gift card? So I think that's a bad idea, a bad feature. But it's a part of the wellness plan. To learn more about these plans and how to redeem the points and so forth, you go to this Be Well SHBP website. You get all the details about how you can earn the points. But just to give you an overview, how do you get these points? There's really 3 ways that you do it. The first one's really simple. You go online and you take this so-called real age test. So they're going to ask you some questions about your lifestyle, exercise, diet, that sort of thing. And no one gets to see the results but you. It's just informative for you. And you get a score. And basically what they're going to do, if you take this test, you're going to earn $120 of points or credits. But as soon as you redeem those are going to turn into dollars that are going to go into, remember the blue box in our HRA plan that we talked about, the HRA account? That's where this money's going to go. All right. So the real age test is just going to tell me when I take it that, okay, I might be 35, but because of the bad habits I have with the tobacco use and the case of beer a day and so forth, that I'm really closer to 45 than 35. And I don't have as long to live as I thought I did. It's just kind of a cutesy way of helping you see that your own lifestyle does affect your longevity. Okay. The second thing that you can do is, and they want you to do, is know what your numbers are so you have an idea what your health status is. So you go to your primary care physician. It's a preventive visit, so it doesn't cost you anything to do that, just a little bit of time. And the physician's going to do this biometric screening. Fancy word for they're going to get your blood pressure, they're going to get your cholesterol, they're going to get your body mass index, give you those numbers so you know what your numbers are. And when you do that, you earn another 120 points that can be redeemed for credits and dollars to go into your blue box, into your HRA account. And then knowing your numbers, they want you to so-called work your plan. You do that one of two ways. You either make a phone call a month to a coach, a Sharecare coach, or you can use their online tracking tool. So this is kind of where Fitbit meets State Health. So two different ways to earn the points. The phone calls are really the easy one now, because if you use the tracking method, it really requires you to go online about 2 days out of every 3. So it's quite a commitment to be doing that. Unless you're really a disciplined person, then it's probably a piece of cake to do it. Otherwise, you make the phone calls to the coach, one a month for 4 months, and every call you make is worth $60, and you can make 4 of those over the course of the year. So another 240 points that you're earning for your wellness credits. So if you've done the math here, as an individual, I'm able to earn 480 points. And if I have a spouse covered as well, and he or she does the activities as well, I can double my money going into the family's blue box, into your wellness credit account, to $960 a year. They're handing you money to take better care of yourself. And a lot of people think it's a nuisance. I'm not a big fan of having to do it myself, but on the other hand, they're handing me basically free money to help me meet my expenses. So when you think about the wellness program, think about it maximizing your blue box. All our slides are red boxes and blue boxes. And remember, in the silver plan, if I were in it for a whole year, just from joining the plan, I'd earn $200, 200 credits into the blue box in the HRA account in the silver. Any money that I earned last year, and remember, you're getting ready to have a partial year, you're going to have not the full $200 in your account, but it's a good chance you won't use any of the money that's in there for the rest of the year. And if you don't, anything you have left over will roll over. And that's true every single year. So in this example, I'm showing you earning $200 base credit just for joining the plan, $150 of rolling over money coming from your wellness credits that you earned in 2020. And then next year you go, and the slide here says 2020, should say 2021, and to next year, and you earn your new set of credits, which will probably be $480 again. And suddenly I've got $830 in this account. All right. Remember what the deductible was in the silver plan? The big red box, $2,000. And now I've got almost half of that paid for in this example. And as you go from year to year and your health is good and you're rolling over these credits, many, many people in the system have that whole deductible met. So there isn't really much of any out-of-pocket expense that they'll have to pay if and when they get ill. So the wellness plan really helps you shrink that red box and makes the only really undesirable portion of these plans look a whole lot better. And remember, I've been using the blue box in the HRA account. If you're in the HMO, you can earn these credits as well. Granted, you don't have that HRA account, but they'll set up a wellness credit account for you if you're in the HMO, and you'll accumulate the credits exactly the same way as you do in the HRA plan. And remember that I've talked about moving back and forth between the plans, and you'll be able to do that without restriction, and your wellness credits will go with you. Okay. Now, we talked about Kaiser only briefly, so let me just mention it real quickly that Kaiser is an option for you, and it's a very unique option. All co-pays, there's no deductible, so no big red box in the Kaiser plan at all. It is more expensive than the Blue Cross Blue Shield HMO, and these are the main reasons why. All co-pays and no deductible makes the plan a little bit more expensive for you. It's probably the best value plan in the mix if you're somebody that uses a fair amount of care. Okay, now there's a tool that we have that sits alongside of the healthcare plan. It's called a medical flexible spending account. And what's the purpose of this? It's just a way for you to set aside some dollars that you're pretty sure you're going to spend out of pocket for anything healthcare. So it could be the red boxes on the slides that we just looked at. It could be out of pocket expense for something like orthodontia or LASIK surgery. So it's those kinds of things. Any place where you think you're going to have health-related out-of-pocket costs, you can set those dollars aside in a flexible spending account. It helps you budget and it helps you reduce the taxes that you pay, because any money that you put aside in a flexible spending account, you don't pay any state, local, or federal taxes on the money. That's the big money reason why people will use a flexible spending account in addition to the budgeting. When you decide that you're going to put X dollars aside in your flexible spending account, um, all of that annual commitment is available to you up front on a debit card. So that's the budgeting aspect. A lot of people like that. If I decide I'm going to put $200 aside in my flexible spending account, $2,400, the whole monthly amount times 12, will be available on a debit card in the beginning of the year. So if I know I'm going to have to meet a deductible, for example, I can meet it all with pre-tax dollars and have all the money available to me up front during the year. So it can be a great tool, and you should consider using it. Okay. Now, one of the downsides to the flexible spending account is that unlike my blue box, which I can roll over anything that I've got in there from one year to the next, in this account, I'm restricted on how much I can roll over. So, and it's $500 a year. So basically, you should be thinking about only putting into my flex spending account what I'm pretty sure I'm going to spend in the current year, because I can't roll over more than $500 in this account. So you just want to be a little bit careful about that. If you don't use all of the money, with the exception of this $500 rollover amount, then you lose that money. So you really don't want to be too aggressive about setting dollars aside. Be conservative, put in there what you know you're going to spend during the year. So you can also set up a flexible spending account for daycare. So this is child care, and I can set aside up to $5,000 a year to pay for child care that enables me to work. This money is only available as I put it in. It's not upfront like it is on the healthcare side. But we have a very smooth process in place here where the dollars come out of your pay. The system wires that money to our administrator, which is called Workterra. That money is available for you to pay the daycare provider pretty much immediately after your paycheck is issued. On these plans, just remember, plan carefully, because there's a use it or lose it provision. 500 of your medical can roll over. Nothing on the dependent care account can roll over. I would say the biggest complaint we get about these plans is on the need to provide receipts. Oftentimes, Workterra will ask us for a receipt. It's the IRS that's requiring to do that, because only certain things are allowed to be paid with a flexible spending account. Think about that trip to CVS. Your prescriptions can be paid for that way with your flex spending, but the flip-flops and the peanuts and the sunglasses off the rack can't be. So they're sometimes going to ask you for expenses. And in all seriousness, you'll be asked for receipts quite often when it's for dental or when it's for vision. Those will be situations where you'll be asked for receipts. Real easy to submit receipts. You have a mobile app. You can take a picture of the receipt and send it, so it's not difficult. But those requests will sometimes come 2 or 3 weeks or so after you've had the expense, and you might have to scramble around for the receipt if you're not ready to provide it. How does the flexible spending fit in with a medical plan? Remember, all the plans have out-of-pocket cost to you, the red boxes, right? And so even if I'm in the HMO, who's in the HMO? Somebody who's pretty sure they're going to have to meet the deductible. Otherwise, they wouldn't have spent the extra money to be in the plan. So I know I'm going to have a baby. I'm going to be in the hospital for a day. I'm certainly going to have to meet this $1,300 deductible. So I can set aside a little bit of money each month into my flexible spending account. $110 a month into flex spending gets me more than $1,300 into my flexible spending account. Remember a couple things about that. The $110 is coming out of my pay before tax. So it's only costing me probably less than $80 in take-home pay to do it, because I'm not paying any state or federal or Social Security tax on the money. And it also gets me $1,300 on a debit card on January 1. So whenever I go into that hospital, I don't have to worry about the big red box I have to pay out of pocket, because I already have it funded and I already have a debit card to hand the hospital to cover that. So it's a great way to budget and plan, and the tax savings make it a good financial deal. In the plan, there's a lot of different ways to save on your health care. As I said, state health is constantly trying to nudge us, push us, pay us, bribe us to take better care of ourselves in the plan. And so we talked about the flex spending and how that can help you. We talked about the mail order drugs. There's an opportunity in all the plan options to join the so-called disease management or prescription waiver program. And what that simply says is that you make a phone call and join that program. And you would do that if your family was dealing with any of these health challenges here: asthma, a coronary artery, diabetes, if you're wrestling with any of those three things and you're a member of this plan, which is just a phone call and no cost to you, then they will suggest a list of drugs that are on the preferred list we talked about. Those medications will be available to you without any copays. So when I talk to people who have, for example, kids that have asthma or folks in their family that have diabetes and so forth, this is an enormous cost savings to them because your share of the medications is basically gone. You're basically getting your medications for free. Okay, so this is something I recommend everybody do, and do it right away. It's again, the contact information is in your benefits at a glance. You can find it on the website, but you definitely want to be part of the disease management program if you're dealing with any of these major things. Okay, remember that the preferred list that we talk about in the drugs, that's not a mystery. That's available for you to look at. It's managed by CVS Caremark. Yep, same parent company as CVS Pharmacy. Doesn't mean you have to go to the CVS Pharmacy. You can still go pretty much anywhere you want to get your prescriptions, but CVS manages that list. So if you want to know what meds are in Tier 1, what meds are in Tier 2, this is the list to look at to find that out. You have an opportunity to buy prescriptions direct. Many of you may have heard about this stuff before where pharmacies are offering their so-called $4 list. Many pharmacies are offering some medications with no out-of-pocket cost at all. Others offering a large list of meds with just a $4 per month cost, $10 for a 90-day supply. Anytime you can buy your medications for $4 a month for a 30-day supply, you're likely to be saving some money. It's not an awful lot to spend. Why would you do that? You would do it because it could be that the copay that you pay under state health would be more. And if you want to do a little bit of homework, you might find that you can save quite a bit of money. So this is a situation where you wouldn't even pull out your card. I mean, the pharmacist will say, all right, well, I'd like to let me have your health insurance card. And you don't want to hand them the card. This is a situation where you're just buying the medication directly from the pharmacy. So you say, no, I don't want to file it under my insurance. I just want to buy the medication directly. Something to think about. Not for everybody. If you don't want to do the homework or you don't want to, but what you basically are trying to avoid what might be the higher copay in your plan for $4 a month. Remember that all the plans have this so-called nurse advice line. So this is a benefit that sort of gets hidden, but there's an 800 number on the back of your ID card when you get it to call the nurse advice line. So this is giving you a medical resource 24/7, no matter what your situation is, that you can call and get some help. So your child wakes up in the middle of the night, he's miserable, you don't know what to do, don't know whether I could call mom, right? We get those calls at my house, but I could also call the nurse advice line and say, look, this is what we have going on. Do we need to get him to the emergency room tonight? Can we wait to go to the pediatrician in the morning? If the answer is the latter, it's going to save you a lot of money and aggravation. So the nurse advice line can help keep you from emergency room in the middle of the night. So you'll know the doctors that are available to you in your area, but what if you're out of town, somebody gets hit in the head with a baseball bat on a Sunday afternoon? Where do you go? Who's open? Who's close? And the nurse advice line will give you a way to find all of that out, and it's available to you 24/7. So very easy to do. And finally, if we have anybody that is military dependent and a participant in TRICARE, there is a supplement available in the state health benefit plan for those of you who are in TRICARE. Very inexpensive option and basically covers out-of-pocket costs that you might have in TRICARE, like the deductibles and copays. Another great way to save some money is in this so-called telemedicine, or really I call it a virtual doctor visit. So we're starting to hear a lot more about these kinds of things. I've been hearing a lot in the discussion of the COVID virus about telemedicine and virtual doctor visits and so forth. But this is a way for you to talk to a doctor pretty much anytime using your mobile device without having to actually go to the doctor. So you're not going to be calling your personal physician or your network physician in the medical plan. You're just going to be talking to a participating doctor on the other end of the 800 line and about minor things, right? So nothing major. I've got the list here on the right-hand side of the slide, sort of the common things. And we have the change of seasons here in Georgia, and you feel like your head's going to explode, and so you just have to get a prescription. Perfect use for telemedicine. Set up an easy visit with a doctor in the plan, do a virtual visit, get a prescription in about 10 or 15 minutes, and you're done. So I think it's a great benefit. You sign up for it by phone. It doesn't cost you anything to be part of it. It's part of the state health plan. So very, very easy to use. Again, contact numbers available for you online. Easy to find it out. Okay, and basically your out-of-pocket cost is reduced to almost nothing. Okay, I did a little math for you here at the bottom, and you see that if I'm in the bronze plan, it costs me a little over $12 to do this. It's silver plan, less than 10, and I have to pay the copay if I'm in the HMO, the primary care copay of $35. But the real benefit to you for this is that you don't have to take any of that valuable sick time that you earn working here to go to the doctor. This is something you can do on the way to work, on the way home, in the evening, without ever having to take any time off at all to get it done. Okay, and remember that, I think we mentioned it several times throughout the discussion, but remember that networks are always important. It really doesn't matter which plan we're talking about, whether it's medical, dental, vision, network providers are always going to be important to you. Okay, so if you're in, one of the medical plans, make sure you get familiar with the network right away. If I'm in the HMO, I have to go to network providers or I don't get any benefit. So in particular, if I'm in the HMO, I want to be sure I'm familiar with, who the providers are. And don't stop with the doctor. You go to a primary care physician that is in the network and you think you're in good shape, and you are for that visit. But if he refers you to a specialist, we need to make sure the specialist is in the network. If he refers you for tests, then we need to make sure the lab is in the network. So you're always asking that question, and got to make sure that you're always going to network providers, particularly in the HMO, or you can wind up getting no benefit at all. So take a look at the State Health Decision Guide. This is a big comparison guide that State Health has put together. If you really want more detail, you want to be able to let a spouse look at the plan side by side, that's what the Decision Guide does. I find it a great resource. I think maybe our help here is a little more help in terms of picking a plan that makes sense for you. But if you really want to know the details about how the plans are different, this Decision Guide is a great way to do it. When you need anything, always start with the benefits section of our website or intranet site. This is where all the information is assembled. We think we have everything there that you could possibly need. So whatever you do, don't be Googling insurance companies or subjects or things like that. For this, start with our own benefits webpage, and I think you'll find all the resources that you need there, contact numbers, guidance, that sort of thing.